I mean, in general, most people are good candidates for hair transplant. You just got to be healthy, have realistic expectations about what we can and can't achieve, and that's part of what the consult's for. We'll talk about that during the consult. As long as there's no wound healing issues or major medical issues, chronic diseases, things like HIV, hepatitis, renal failure, those types of things might preclude us from doing a hair transplant depending on the patient's overall health. But in general, almost anybody's a good candidate for a hair transplant as long as they've got hair to donate to themselves, which is essentially what a hair transplant is. So an FUT transplant, or follicular unit transplant, is a strip method. FUE means follicular unit excision, or less commonly used term now, follicular unit extraction technique, and that's where we're punching out hair grafts individually versus taking a strip of tissue from the back of the scalp typically. Both are actually really good techniques. In today's world, unfortunately, there's a lot of advertising and marketing efforts out there where FUE is promoted as really the only way or the proper way or the best way to do a hair transplant, and really that's not the case. Both techniques can be really good. FUE might be a better option because it's going to keep us from having as noticeable of a scar on the scalp. Technically, both procedures do have some scarring on the scalp, but it's generally very minimal, and as long as we pick the right method, it's really well hidden. Graft count and estimations typically come from experience. As long as you're going to somebody who does a lot of hair transplants like us, we can sort of estimate those counts. It typically depends on what the existing hair density is in the area. For instance, if a man is thinning out in the frontal zone, but there's still some hair there, well, we can use that natural hair to add density, and the size of the area and the amount of hair that's there already both determine how many grafts we need to fill that in. If we're creating something new, for instance, a new hairline that's being lowered, filling in hair into a scar that doesn't have any hair, adding hair to a beard for a beard or mustache transplant that doesn't have any hair in that area, well, we're going to need higher density and higher graft counts in order to make that hair look dense and make that area look full. So hair transplant, like a lot of other procedures, it just takes time to see the final results. In general, you're looking at about a 10-day recovery window. That means taking it easy physically, no heavy lifting, no exercise, not getting hot, sweaty, dirty, anything like that. And that really goes for any type of hair transplant: beard and mustache, eyebrows, women's hair, men's hair. It's really all conceptually the same thing. You need about 10 days of not looking your best because something's going to be visible somewhere where there's scabs or crusts holding the grafts in place, and then restricting your physical activity. And then what happens is after about that 10-day mark, we let patients go back to normal activities, normal washing and hygiene practices. The hairs will sometimes come out with the scabs, and it'll sort of look like not a whole lot happened. At that point, it's just a waiting game. Usually around a month or so, the results are really unimpressive. We're not seeing much at all. By the time we get to 3 or 4 months post-op, we'll start to see a little bit of growth in the area. By 6 months, we should really see the growth picking up. And then we're really not judging the final results until closer to 9 to 12 months post-op. Then at that point, we've gotten length to the hair texture is matured a bit, and we're starting to see better and better density. And that's when we really judge, okay, this is what we see. If we want to do a second procedure at that point, that's usually a pretty good time to start talking about that, or we're happy with the results and we just move on from there.